So we're into neurodevelopment, and the first speaker is Dr. Sheryl Smith, and we look forward to the talk.
Thank you, and thank you to the organizers for this wonderful meeting. Okay, how do I change slides? This thing? Okay. Adolescence is a critical period when learning potential changes and certain mental disorders such as anxiety first emerge. One factor underlying these different outcomes is the pubertal change in GABA A receptors. This receptor mediates most inhibition in the brain and is a pentameric membrane protein, as most of you know, comprised of variable subunits. Most GABA receptors are found at the GABA synapse, but some are away from the synapse, extrasynaptic. One of these is alpha-4 beta-delta. This receptor normally has low expression in most areas of the adult brain, but we have shown it increases its expression in CA1 hippocampus at the onset of puberty in female mice. It is localized to the soma, to the dendritic shaft, and the dendritic spine, close to the excitatory synapse. This is delta staining in an electron micrograph taken by my collaborator Chia Aoki at NYU, and this is alpha-4, also on a spine next to an excitatory synapse. There was about a 3 to 5-fold increase in alpha-4 and delta at puberty compared to before puberty. We went on to show that these receptors were functional based on the response to the GABA agonist gaboxidol, which is selective for alpha-4 beta-delta. And these are whole cell patch clamp recordings from the hippocampal slice. You can see there's a bigger response at puberty compared to before or after. We also showed that alpha-4 is increased in the prelimbic prefrontal cortex at puberty compared to before and after, also localized to the soma, dendrite, and spine. Again, this is a transient increase, about 10 to 14 days. Puberty marks the end of an optimal learning period for learning a language and certain visual motor tasks. We wanted to explore the possible reasons in a mouse model, and we had turned our attention to this receptor because it's localized to the excitatory synapse. First of all, we found that it was much harder to activate NMDA receptors. These are NMDA EPSPs at puberty. You can see there's very little activation compared to before puberty when there's a much bigger response. However, if you look at an alpha-4 knockout mouse, you can see there is a bigger response. Again, the NMDA to AMPA ratio is low at puberty compared to before. So obviously NMDA receptors are important for synaptic plasticity, so we then turned our attention to looking at long-term potentiation in the hippocampus. This is induced by theta burst stimulation, and you can see before puberty you have a very robust LTP, about 175% potentiation. We were unable to induce LTP at puberty, again, unless we looked at an alpha-4 knockout mouse. And of course, we went to the next level, which was to actually look at spatial learning using, by now, the well-known Andre Fenton spatial learning task. As you know, the mouse must avoid an electrified sector when the platform is rotating. After the initial acclimation, there are 3 training trials where the mouse receives a shock, and you can see before puberty there is an increase in the latency to enter the shock zone. So the prepubertal mouse learns very well compared to the pubertal mouse, which is not nearly as fast or as long of a latency to enter the shock zone. But again, the alpha-4 knockout mouse has a nice progressive increase in latency, showing that it is a very good learner compared to the pubertal mouse, pubertal wild-type mouse. So this suggests that these alpha-4 beta-delta GABA receptors at puberty may underlie at least some of the impairment in learning potential at puberty. So the prefrontal cortex is another area we like. It plays a pivotal role in regulating mood, such as anxiety, which my lab is interested in. Specifically, the mouse prelimbic, right here, which is homologous to the human dorsal prefrontal and anterior cingulate, increases anxiety, whereas the mouse infralimbic, homologous to the human ventromedial prefrontal cortex, decreases anxiety. The prefrontal cortex is known to undergo synaptic pruning in adolescence at a time when alpha-4 beta-delta GABA receptors are increased. So we wondered whether these receptors played a role in pruning. And we were interested in the prelimbic because of its role in anxiety. You can see here comparing puberty to post-puberty. These are dendrites. There is about a 63% decrease in spine density, with the biggest decrease in these large-headed, stable mushroom spines. We then took advantage of the Cre lock system to inject Cre recombinase in an alpha-4 floxed mouse. You can see here we're targeting the prelimbic. And if we inject on postnatal day 21, by postnatal day 35, we have almost undetectable alpha-4 staining compared to the GFP control. So when we knock out alpha-4 in the prelimbic, we can see a significant increase in spine density, about a twofold increase in spine density at this time, which suggests that these alpha-4 beta delta GABA A receptors play a very important role in synaptic pruning, at least in the prelimbic cortex. So this suggested a mechanism, but it was also a tool to ask our next question: would preventing pruning increase anxiety behavior? So we used the same mice, or actually different mice, but the same technique, and we used the elevated plus maze, which is elevated 2 feet above the floor. There are 2 open arms and 2 closed arms. The mouse is timed for 5 minutes, and a decrease in open arm time suggests an increase in anxiety or avoidance behavior. The mice injected with Cre that had more synaptic input into the prelimbic, where there would be more excitation, had a decrease in open arm time, suggesting that they had increased anxiety when tested both at postnatal day 56 and as well as at postnatal day 90. There was no change in locomotor activity. So this suggests that synaptic pruning of the prelimbic is actually necessary to limit anxiety in adulthood. And finally, our ongoing studies are investigating the effect of stress on mood, comparing predictable and unpredictable stress. The mice are stressed for 2 weeks beginning at the onset of puberty and then tested 2 days later or later in adulthood. The predictable stress, the mice are placed in restraint tubes for 2 hours a day at the same time every day for 2 weeks. And one of the tests is the forced swim test. For this test, the mouse is placed in a beaker of water where it must move and swim to stay afloat, or it becomes immobile, and that's a sign of despair. So a decrease in time immobile reflects resilience. And what we found is that female adolescent mice that were stressed in this predictable way actually had a decrease in time immobile. And we were very surprised at this finding, meaning they have increased resilience. It was actually good for them to undergo predictable stress. And this improved resilience was maintained into adulthood, but it was not seen in male mice. It was also not seen in mice stressed as adults, and it was not seen in alpha-4 knockout mice, again suggesting that alpha-4 beta delta GABA receptors may play a role. But in contrast, there was actually no change in the elevated plus maze, so there was no change in anxiety with predictable stress. So the next test that we did was unpredictable stress. There are 6 different kinds of stress that we used: restraint, no bedding, wet bedding, cold room, tilted cage, predator scent, at unpredictable times of the day, twice a day for unpredictable durations. And we found these mice did not have a change in time immobile. They were not more resilient, but they did have a decrease in open arm time, suggesting that they had increased anxiety. So to finally conclude, chronic predictable stress increases resilience in adolescent female mice, which appears to be due to alpha-4 beta delta GABA A receptors, and chronic unpredictable stress increases anxiety in adolescents. We are now really involved in figuring out the mechanism. One pathway to anxiety could be dysregulation of pruning, and we're actually testing that right now, and that is a process which is dependent upon alpha-4 beta delta GABA A receptors. So therefore, these receptors play a role in both limiting learning and limiting anxiety at puberty. That's all I have.
Thank you.